Hello and welcome to the Naturopathic Business on a Shoestring podcast. I'm your host, Dr. Michael Smith, a naturopathic medical doctor who is passionate about the business side of medicine and providing quality naturopathic medical care in the most financially friendly way possible. Thanks for being here. The focus of today's podcast is all about electronic medical records. Now, there is some terminology about electronic health records versus electronic medical records, EHR versus EMR. For me, I'm going to call them EMRs because that's what I'm most comfortable with, but however you term them, it's all the same thing. Basically, an electronic medical records system is a software that helps you as a provider keep track of your patients. There are many different platforms that we can use to do that. Some that are more expensive than others, some that are easier to use than others, and some that have different functionality. There's a host of options available, and as I start my practice, I am needing to pick one for me to use. When I was in school, the training that I did was using the software system called Epic. Now, Epic is very, for lack of a better word, epic in the fact that it is a very large, very robust EHR, EMR software system. It is used nationally and perhaps even internationally by many of the large hospital systems in the United States. The chances are, if you've heard of something called MyChart or MyHealth or Epic, they're all related and connected together with this big software system. It works really well for big hospitals, for academic institutions like the one that I attended, in the fact that you're able to learn and do a lot of things very easily with the software system to take care of the patients that you have. There's some challenges, though, and the biggest challenge with Epic is its cost. This cost is epic. It costs tens of thousands of dollars for an institution to get a license for Epic. So for a small practitioner starting out with one provider, Epic is definitely out of the question. We need to find something else that's better for the small single practitioner, the solopreneur, so to speak. So as I've been figuring out what the next best thing is for me, there's several options that I've been looking at and shopping around and comparing. There's several features that are important to me as a provider. Then they might be different than the features that are important to you as a provider. But nevertheless, there's some basic functionalities I think that we can maybe agree that would be helpful to start a practice. Now, I am starting a cash-based practice, which means I'm not going to accept insurance. If you accept insurance, there's some billing factors and features that you may want to have and focus on in your practice. For me, that's not what I'm doing. So the things that I do may or may not be the same things that you do, and that's totally great. There are many different EMR systems out there. Many different providers use different ones, but there are some that I have heard about through either using them, observing doctors who do use them, or referencing or hearing about providers that recommend them. There's many options available, and I've kind of whittled it down to 4. There's 4 that I'm going to dive into, and we'll get there in a minute. But I think it's really important to remember that ultimately you're going to get an EMR system that keeps track of patients and their medical information, your soap notes, your prescriptions, and things like that. It's all going to come out the same effectively. And it's just a matter of what interface works best for you. The best analogy that I can think of on this is a cookie. And I grew up in Utah, which is known as, and maybe informally, as the cookie and dirty soda capital of the world, or at least I think it is. Personally, I'm not a dirty soda kind of person, but I have been to only one cookie shop. I honestly can't remember the name. But there's several out there. There's Crumble, there's Chip, there's Dirty Dough, Twisted Sugar, Crave, you name it, you can go on. There's a lot of these cookie shops, and they make these gourmet cookies. They're huge. They're maybe 4 inches around, and they have these crazy flavors. And you can get the plain chocolate chip. You can get the double, triple chocolate with extra chocolate. You can get the red velvet kind. You can get the lemon curd flavored, pina colada flavored. I don't know. I'm making these up. You get the idea. There's so many options, and maybe you've been to them. You know more than I do about them. When you go into a shop, though, you're looking for a cookie, and when you leave a shop, you're going to come out with a cookie, supposing that that's what you went in there to get. And EMRs are kind of like that. You're going to go into a shop, and I'm going to take you into the shop where the menu options, there's 4 that I'm looking at. And you're going to come out with an EMR system, and there's some that are more expensive than others. And for being on a budget, that's important for me. I'm trying to conserve my funds so that I can best help grow my business and help other people most effectively, including myself and my family, because I'm providing for them primarily. So we're going to dive in to 4 main systems here. Number 1 is Charm. Number 2 is Healthie. That's Healthie, Healthie. Number 3 is PracticeBetter, and number 4 is Elation. So we're going to dive into those, and I'm going to take you on a screenshot tour of what it is like to use each of these systems, features that I like, and what it is like to use them. For this simple exercise, I'm going to create a model patient in this demo practice environment, and I'm going to create an encounter for them and just open it up and navigate through that. And as at this very moment of recording, I have not as yet decided which one I'm going to choose. It's going to be one of these 4 because I need to make a decision, and I need to move forward with that decision. I've actually no, it's going to be one of 3, and I'll tell you why later. But I need to make that decision. So this process is actually part of my decision of which EMR I'm going to be using for my practice. And then I'll show you some breakdowns of why I chose different ones a little later. Now, I just want to give a quick disclaimer. With this tour, going into some EMR systems and poking around, looking at them, there is 0 patient information. I am very respectful of all HIPAA and privacy laws that pertain to patient information. There is 0. Oftentimes, these are fake patients, and my intent with this is to simply look at the software itself and not explore and not dive into any patient information. So just to you understand that going into it, you're not going to see any patient information, but it may be good that you consider that most, if not all, EMR systems are HIPAA compliant, which allows for that safety protection of health information. So let's dive in. One quick note, if you are listening to this on the audio version of the podcast, you're not going to be able to see everything that I am going to be showing on the video version of the podcast, because I'm going to be clicking through websites and other things like that. So if you wanted to see what you're actually hearing about, then switch over sometime to go to the YouTube version. If you want to skip ahead to the end of the podcast and hear which EMR I actually decided to end up using, feel free to do that, but just to let you know that there's going to be some visual features that are not going to come through on the audio. So here we go. Okay, so here we are. I'm going to start with Charm, Charm is a software that I have seen used in many different clinics. I think it's one of probably the more popular ones that I have seen used in clinical practice by naturopathic doctors, naturopathic medical doctors. By far, it's not the only one, but it's definitely, I think, the more popular of them. Charm has a lot of functionality that I have seen used. There's a lot here, so let's walk through it. We open up the patients, the number of patients that we have. Wait for my internet to load up. It's all internet-based. I'm going to create a patient. Here, test patient, date of birth 01/01/1900, even though let's just say that male for now. And we can obviously fill in all of the other required information at a later time, but I'm going to add that test patient to my system. After that, we can go into calendar and see what the calendar appointments are. For many different for clinics that have multiple providers within them, I have seen it broken down with different columns for each provider, being able to see which provider has patients when their availabilities are, to see patients at different times of the day and the week. So we can sort by facility. This is my practice, Focused Family Integrative Medicine. That is me, the provider, and we can see that I don't have anything right now, so we are going to keep moving forward. Chart notes would be, this is where the charts would be. So let's create an encounter. Test patient. This is the one that I just created. We are going to create visit type. Let's just say it's a follow-up visit. I will note I have not yet configured this fully the way that I would want it. I'm waiting to invest that time and energy after deciding which one to do. But I'm just going to pick the SOAP template because that is what I would most likely start with. So I'm going to create that. There's no SOAP templates configured. Like I said, I could do that later. Chief complaints, headache, vital signs, etc. I could add prescriptions to that. Allergies, prescriptions. Let's say that they are taking Zyrtec. And let's pick not the oral syrup, not the liquid gels. Yeah, let's just say that one, just for fun. They're taking one a day orally. So when we want to dispense, we dispense 30 additional refills, maybe one. Add. That's what they're taking already. You can also add any supplements, which for naturopathic providers, that's important to keep track of. Add labs, images, follow-up, handouts, referrals. There's a lot that can be done. I'm not going to dive into all of this right now, but for some of it, follow-up, we want to see this person for an office visit after 4 weeks. Add. We can add any handouts per there. Let me see. I'm exploring this as I share this. So it's important to save before moving on to the next template. We add procedure codes to that. I think it's important to remember that just like any software, especially, there's going to be a learning curve, and it's going to take time to get used to. I'm not used to any of these. I've entered a little bit of data into Charm during my observation as a student for the provider I was precepting and shadowing with, but I have not used it myself. So this is me in my raw self looking around at these. There's a lot of functionality that we can do. We can assign, we can print patient summary, chart notes if we preview it, objective, plan, and so forth. I'm going to leave it there because I don't want to spend a lot of time. But exploring other options for the pharmacy requests that are coming in. This is where the lab comes in. We can see the values in this dummy patient for a lipid panel where values are high or low. We can save it to the chart, sign it, and so forth. Print it out to give it to the patient. Imaging as well, and so forth. There is, to take you on a little bit more of a tour, there is a lot of functionality features that can be integrated with full script, whole scripts for the electronic prescribing, which is something that's important for me. There's billing, and so forth. Charm is by far, like I said, one of the ones that I've seen the most. One thing I do like is, I don't have it here, is the ability for patients to schedule their own visits with online. So on the top of your website, you can say schedule appointment, and then it drops down to show you the availability of the provider, you, me, and what you're able to, when you're available. So the patient can just schedule without needing to call you or your front desk to be able to do that. With Charm pricing, there are different options. You can have a free plan, and that's what I'm operating under right now. The plan that I would probably start with, if I was to go with it, is the Encounter Plan Flexi pricing. So it basically charges 50 cents per encounter. Each time you see a patient, that is 50 cents for a monthly minimum of 25 cents. And you can go on to their website and look at all of these other features. For electronic prescribing, it is $10 extra per provider. For a fax line, which I think is important, even though we're in the 21st century, faxes are still important and used. That's $25 a month, and a lot of other features that you can add on to your Charm software membership. There is a fixed pricing per provider. It doesn't base it off encounters. So if you're really busy, this might be a better option because it has a lot of functionality that automatically built in with the e-prescribing, the PDMP, the physician drug monitoring program, prescription drug monitoring program. And other things that this Flexi plan doesn't have. So there's advantages. It is $350 per month, which for me as a new provider, that's a lot of money. And so I'm not going to spend $350 a month for that. I would just do this flexible plan. Let's jump over to Healthie. Healthie is a plan that very similarly, you can go on and get a trial. I might have 2 days left in my trial, which means I need to make a decision soon. I don't have any appointments today. The nice thing is I can brand it with my own practice company branding, logo, etc. In here, patients are referred to as clients. For some people, that may not be a matter. For me, I am programmed to think of patients as patients. So to see clients, it actually throws my brain off a little bit. And that is an important feature for me as I think about which plan that I use, which EHR I use. So I'm going to add a client. In this case, let's say test patient. Client group, not going to worry about contact information. Do not send client invite email, though you can do that. And test patient, I'm going to, you can see their profile, their photo, and other things like that. We're going to book an appointment for this person. Let's do an initial consult, in person at the office. You could distinguish if you have multiple practice locations. Start time, let's do today at, where are we? Let's say 5 p.m. 5 a.m. I don't want to do 5 a.m. I will still most likely be sleeping at that time. Let's do 5 p.m. That's my time zone. Create. So that's the appointment. I'm going to like I said, I'm exploring this right here. Update. So here we got create a note. I'm going to use the SOAP format. And here we go. Subjective. 30-year-old male presents to clinic with headache times 5 days, ... That's actually a comma. I should put ... Objectives, objective findings, assessment, and plan. For that, I'm going to save that. I could lock the note. I'm not going to close it right now. Where to find creating a super bill. If you wanted to do that, you could send it as a fax, generate a PDF. I'm looking for the place where I enter vitals. That is not obvious to me. It doesn't mean it can't be done. You can have intake forms and so forth. So there's Healthie. Is it my favorite? I don't know. Here we go. We can look at our clients. We can look at our calendar to see what appointments we have. We got this one today. We can manage documents, any scanned things that come in for that patient. And we can watch all of those things. Forms. I'm not going to go through the other features, but because that's what I wanted to do. Let's join the appointment. Okay, nothing we didn't do. Okay, Healthie. Well, this is what I was referring to. This is my clinic online scheduling platform for patients to use when they come to my website. So I can go to book an appointment. I can include this URL on my website. I don't have any availability, so it's hard. They can't pick right now, but pick one of these types of visits that are available and go from there. Pricing, there are several different plans. I would go with the plus one because of the features that it has, and you can go on their website and look at it all again. This might have been obvious, but I don't have any affiliations with any of these, so I'm giving my honest, unbiased opinion. I should have said that earlier because that's important to know. It doesn't matter to me which one you'd go with. I have no affiliations at all. So this is me finding what works for me. We'll go through more of that in a minute. Let's go to PracticeBetter. I first heard about PracticeBetter from a nutrition elective class that I took as part of my ND program, and I think it's really geared toward nutritionists being able to keep track of diet plans, diet diaries, things like that. So they have really good setup onboarding checklists, which I've kind of gone through a little bit of already. This plan has up to this very free plan has up to 3 clients that you can play around with. So I'm going to do that. Add client. test patient email address is, I don't want to put an email address. I'm going to use this one because that's one that a junk one that I use. Create client profile only. And this is, you can have them complete different forms if you wanted to, on their intake. This is an intake form that I made way back when, based off of a previous practice name that I had. So I'm going to then go and click add. Next steps, I want to book a session. And that session, initial consultation, there's mountain time. Let's pick one for today at, scrolling down, make sure I get my AM and PM correct, 5 p.m. No fees, but you can set that up and go to schedule. Never mind. Schedule anyway. Take notes for this session. Okay. So far, I really like this flow. And if I remember right, you can set up templates. This is not set up for a SOAP format, but it can be done. I'm looking around here. This is kind of fun. Adding a table. I think this is the form. Notes, documents. "25-year-old with a headache." So forth. Okay. I don't know what all these features are. I will need to spend some time getting to know it better. Save notes, and I'm not going to sign it right now, but I could. Protocols, labs, tasks. I can also go back, link a lab, link to booking. I think it was already booked that way. Adding section, adding task, insurance codes, ICD code. Let's do headache. Something like that. Diagnosis code, procedure codes, things like that. Documents, save, and exit. There we go. There's the online video chat. We have diagnosis codes and so forth. I'm going to go back to my schedule, clients, test patient, billing and payments. Allows you to keep track of all that. I'm going to be cash pay. I'm not going to worry about that right now. Onboarding guide, calendar, and so forth. Okay, this is the PracticeBetter initial consultation. Book now. I actually have kind of set this up a little bit, finding available times. I don't have this set up yet, but it is possible for them to pick that and then go from there. Pricing, $89 a month is the plan, the plus plan, with a lot of different features and so forth. We'll go into that later. Lastly but not leastly, thank you for hanging in here, is Elation. It's a software that I heard about that a provider that I know and respect really uses, and so I wanted to try it out. I called and had an initial welcome with their sales representative, had a very good visit, and he walked me through this. He shared a link to a demo test site that I'm using right now. I think to share a few things that he shared, here's a calendar. There's only really 2 pages here on this Elation site. This main page and then the SOAP note format. What I'm going to do, I'm going to try to add a patient. So, new chart, patient details, test, patient, date of birth, 01/01/1900, male, contact, etc., adding the pharmacy, what the provider is, and so forth. Create and open chart. So now it opens up the chart of what the patient is, what I'm going to see them for. You can add and update all of these allergies, drug interactions, problem list, history, things like that, permanent meds, vaccines, filling out a clinical profile. SOAP note for the patient right now. The problem, the SOAP follow-up, and so forth. I'm not going to worry about adding that, but we could if we wanted to. We can see what orders there are. We can add lab orders through lab core request, imaging orders as well for different imaging centers, adding a prescription. You can select a pharmacy, sending it, e-prescribing, etc. Very simple, very easy to use. In some ways it's no frills, in some ways it's really high frills, because as doctors we don't want to be spending a lot of time diving into all of these things, these features. So this is their website. There's a lot of information, but what they don't have is they don't have a pricing page. If you go to pricing, it's going to be challenging for you to find all those features like we have on the other plans, and they request that you schedule an appointment to provide that. So that is the challenge so far with Elation. They kind of hold their cards a little tight. So let's dive. I'll share them more about that in a minute. But here we are. 4 softwares. We got Charm, we've got Healthie, we've got PracticeBetter, and we've got Elation that I'm going to be choosing between in a matter of minutes. So there we go. There's your whirlwind tour. So here is a table that I have made with all of these different plans and the features that are most important to me. Now, they might be different than the features that are most important to you, and that's totally fine. But I just wanted to show you and walk you through the decision-making process for me as I pick an EMR plan that is cost-effective for me and for my practice that I'm trying to start. So we've got Charm, Healthie, PracticeBetter, and Elation. As like you said, the price for Charm is 50 cents per encounter, $25 minimum per month. Healthie is a little bit more, it's $129. PracticeBetter is $89, and Elation is the most expensive. It's $315 per month, or if you go on a yearly annual billing plan, you pay the $3,000 something for the entire year. It comes down to about $270 per month. Now, I will note that Charm is very comparable to Elation in that way. In that Charm, for that equivalent plan, for the full-blown plan, is $350. So it's actually almost the most expensive with all the features. Elation would be there. If it was simply on price between Charm and Elation, I would probably go with Elation because it's a little more simple and easy to use than Charm is. And it's also cheaper, the $315 versus the $350. However, I don't have that budget right now, so I'm not going to do that. The next column, the third one down, the number of patients, clients. For Charm, it's up to 1,000 with the $350 plan. It's unlimited. Healthie, PracticeBetter, and Elation, there are an unlimited number of patients or clients that you can have in their system. Dedicated fax line, it does cost extra for Charm, up to $25 per month. Healthie, it's included along with PracticeBetter and Elation. E-prescribing, it costs extra for Charm and Healthie, but it's included with PracticeBetter and Elation. Electronic scheduling is on all of them. Something that may or may not be important, I'm still trying to decide that for myself, is inventory management. This is if you wanted to carry an in-house medicinary or dispensary in your clinic. You wanted to have things that you can just grab off the shelf and give to your patients. This would be a way of keeping track of that inventory. What you have, what you're selling the patient. You can combine the bill of your visit with the supplements or products that you're giving to the patient after that. So they get one bill, especially if it's a cash pay bill. They will see that. So inventory management was only with Charm. I could not see it with others. And in that case, I would probably just refer to FullScript and just have the FullScript be my dispensary, my medicinary, and that allow the patient to order their products online and have it shipped directly to them. For the telehealth video calls, it's extra for Charm, included in Healthie and PracticeBetter and Elation. I will note that there is a product called Doxy.me, that offers for free video calls, telehealth video calls. So if I was to get Charm, I would not pay that extra $20, which is why it's in parentheses. I would just use Doxy, and it would allow me to have that capabilities of having a virtual waiting room with patients and seeing patients that way without paying extra for an inexpensive HIPAA-safe Zoom license or any other software. FullScript integration is included with Healthie and PracticeBetter, possibly with Charm as well, although I didn't dive into that as much. Rupa Health is a software platform that allows you for easy and cost-effective ordering of laboratory testing from a myriad of sources. You can order from any test menu panel from so many different laboratories, and they make it really easy to do that. It's integrated with Healthie, PracticeBetter, and Elation, and that's something that's important for me that I want to use. Storage, there is with Charm, there's 25 gigabytes. There's PracticeBetter that has 10 gigabytes. And like I said before, patients versus clients. Charm and Elation refer to them as patients. Healthie and PracticeBetter refer to them as clients. Technically, patients are clients. Not all clients are patients because the patient-doctor relationship is only established with, I think, doctors. So that's why clients are included, so that other providers, including nutritionists or other like health coaches or other occupations, can use those platforms, and it is geared toward them. Total cost, after all those things are added on, we get Charm, which is at least $60 per month if I get more patients than that. Healthie would be $169 because of the base cost plus the $40 per month for e-prescribing. PracticeBetter is $89 per month, and Elation is the $315, as I discussed earlier. So there you have it. There's my analysis. That's reflecting of what it looks like today. Could change in the future, which is why I put the date at the bottom of the current pricing offerings and the features as they currently exist. So there you have it. That is what the comparison looks like. Okay, so it's been a few hours since I last recorded and went through those screenshots of all the different EMRs that I was looking at. The Charm, Healthie, PracticeBetter, and Elation. And it when I finished that, it wasn't very clear to me which one I wanted. Like, there was features and I was still kind of on the fence. So I needed to do a lot more kind of exploring and things offline, off camera, to decide what I wanted for my practice. And I kind of narrowed it down, and for lots of different reasons. The one that I really didn't want, for purely for cost purposes, was Elation. It's a great software program. I would recommend it if I had the funds. I think it's a great platform, great company, great features, but simply for me on a budget, trying to operate a naturopathic medical practice with very little income and starting from scratch, it was not going to be cost effective for me to use Elation during this time. So that one was out. I was looking at the features of Healthie, and it just didn't jive with me for lots of different reasons. It was also the second most expensive one after Elation. So that was kind of out. So for me, it was kind of between PracticeBetter and Charm. The reasons I like PracticeBetter is that there was just a nice workflow of like creating an encounter, or creating a patient, then creating an encounter, and so forth, kind of going down from there. It's a good software, but it really is geared toward nutritionists, is what I feel like. I think there's functionality for doctors like myself, but it wasn't what I needed ultimately. And I only came to that realization after playing with it some more and going through some setup and figuring out how it worked. One thing that was hard for me is that when I was writing a chart note, I couldn't go in PracticeBetter. I couldn't easily like write a prescription, for example. I couldn't even figure out how to add a prescription very easily. So if that one singular feature was not going to be there, and I know that I'm going to be writing prescriptions because my scope in Idaho allows for prescribing ability for everything except for controlled substances, or at least most things except for controlled substances. If I can't do that easily, then it's not going to work for me. And it was kind of felt cumbersome. So then I went back to Charm. And as I started using Charm, I realized that, okay, yes, this is what I wanted to use. This is what I want to use in my practice. It's the one I'm most familiar with. I've seen a lot of doctors chart with Charm. Part of our education is precepting and watching and helping be in clinics in the community. And two of the clinics that I spent the most time in used Charm, and I saw it used a lot. I saw the functionality. I saw how it works, how the flow works in the clinic, and it resonated with me. Now, I could have gone into that right at the beginning, knowing that, like, okay, let's just do Charm just because. But I wanted to make sure that that was the right choice for me. And frankly, it was kind of almost at the bottom of my list just because I was maybe hoping for something better. But really, I realized that Charm is the best thing for me right now. So I'm going to switch to go through some of the features of how I'm going to use Charm and some considerations, because it doesn't have all the features that I want, but it has enough, and I'm going to adapt in other ways to make it work for me. So I'm going to do that, switch over right now. Okay, so I basically took out all the other columns of my table that I made earlier, and with the, so I'm going to go with Charm, and with the number of patients, there is a max of 1,000. And when I get to that max of 1,000, which I hope could be soon, I hope to be able to be earning enough money to be able to afford a more expensive EMR soft version or plan within Charm. So I will upgrade from this 50 cents per encounter version, this flex plan, to the provider plan, where it's $350 a month. and I get all the features and unlimited patients and things like that. So I think I'm gonna cross that bridge, and I'm planning on crossing that bridge, but I'm also planning on being able to afford to cross that bridge later. With e-prescribing, I'm definitely going to pay for that. I think that's worth it for me. With telehealth, like I said earlier, I'm not going to use the features in Charm. I'm going to use Doxy. There's a possibility I could use Zoom, but I will cross that bridge at a later time. But Doxy is free. I've already looked at it, and it looks like a good solution for me. With both FullScript and Rupa, there is not integrations, at least immediately, that I can see. I'm going to keep digging around for that and learn about that more. When I spoke with a representative from Rupa Health, they did talk about how Charm was on their radar for integrations in the future, so that's something to look forward to as far as having those lab features being able to be integrated and order within Charm and have reports sent directly back into Charm. But for now, I think I'm able to work around that by ordering simply just on their websites, platforms, and that will work. And ultimately, the user experience for me as a provider allows me to practice medicine in the best way that I feel like I can. And with being able to record all of the medical subjective, the history, the background of the patient, the social history, family history, being able to document all of the physical exams, and ultimately produce the best quality the best quality medical care, I think is found in Charm for me, of the 4 that I looked at. There might be others out there that are better, but for me right now, Charm is the software that I'm going to use. And at $60 a month for a starting budget, factoring in the $25 for the fax line, $25 for the base cost, and $10 for the e-prescribing, I think that's very doable for me. That's it's actually the cheapest version of the 4, and I think it's going to work really well. So that is my journey into EMRs. Choosing one, you saw it live, going back and forth, taking some time back off to look at it even more, coming back, sharing with you what I've learned, and this journey that it's been on. So I am excited to move forward. I've already was able to integrate it a little with my website that I'm building for my practice, and it's going to work really well, and I'm really excited. So I hope that this might be helpful for you as you go through the process of picking an EMR, thinking about things that matter to you in your practice, what features matter to you and that are maybe dependent on how you accept payments. Are you going to be billing? Are you going to be only cash pay, or both? Are you going to be e-prescribing or not? There's a lot of factors that will influence your own decision. And however you proceed, I know it's going to be awesome. I know that you're going to make the best decision for you, and I hope this has been helpful. If you have any further questions, or if you have any things that you'd like to learn about more with EMRs, drop it in the comments below for YouTube, or send a message, and I'd love to talk more, and we can discuss and figure out, make sure that what you're getting is optimal for you. So I hope this has been helpful. And on this episode of Naturopathic Business on a Shoestring, this is Dr. Michael Smith signing off. Thank you for joining me on the Naturopathic Business on a Shoestring podcast. I hope you enjoyed it. If you did, share it with a friend. We look forward to seeing you next time.